Hello, my friends. Today we will be taking a dive into bone health, how menopause affects the bones and the bone-brain axis. Please remember to like this video, drop a comment, and subscribe. There are different phases of life. In our 20s, there's a certain set of things we need to be thinking about more so than in our 30s, 40s, 50s, 60s, and beyond. Every season of our life is different. Let's take bones, for instance. Women build bones until about 28 and men about 30. Then we reach peak bone mass. We then reach a plateau where we keep our bone density, and then in women, it begins to plummet due to hormonal influence. Men usually maintain their bone density until their 70s. When they plummet, it is usually because they have a metabolic problem, an autoimmune disease, or having had the need to take a lot of steroids. We see a big difference at 50 in bones. That's a good example of how every few decades our bones are reacting differently. Muscle is the same way. We know that we can gain muscle at any time in our lives, but we do it most easily until we're about 30. We also know of changes in the way our gut functions as we age, having to do with absorption of nutrients. Women in midlife, for instance, need vitamins that are something called methylated, which means broken down a little more because our gut function is less efficient. So every phase of our aging we're different. Why do men's bones maintain their density longer than women's? Men build more bone initially, thicker cortices, more absolute poundage of bones because of the influence of testosterone and the genetics of having XY chromosomes. Women during menopause, due to plummeting of estrogen, which is critical for bone health, women lose bone faster than men. Such that after about the age of 40, when we get to that plateau, women start to lose bone density about 20% by the time we get to menopause. That can have dire effects for women. Is loss of bone density inevitable for women? No, it's not. Studies show that bashing your bones, which means subjecting them to impact through activities like jumping or running, is as important in maintaining bone density as things you can't control, like your age, whether you're born with XX chromosomes or XY chromosomes or have a family history of bone loss. So, impacting bones, causing them to build up over time, is critically important for maintaining bone density. Loss of estrogen is inevitable. Loss of bone density doesn't have to result in osteoporosis, fracture, and frailty. So, I want to get into why that's happening, but just to pause there, let's talk about the importance of bone health. Why is bone health crucial for overall health? A lot of people don't think bones are that important. Many people see our bones as just something we can't influence. You don't think of them like muscles. Muscles, you go to the gym, you can expand them, you can get strong. But with bones, it feels like they're static. So, how would I start caring about my bones? You may ask. And what is the cost if I don't care about my bones? Here's why we should care. Your bones outlives anything. Scientists can tell from your bone health how one lived, how healthy they were, and how they died. Muscle goes away, skin goes away, everything except your bones remain. Fascinating, right? Another reason we think about our bones is when they break. People think bones are silent, like the strong silent type, just hanging back until they break. Let us go through some bone statistics. 1 in 2 women will have an osteoporotic fracture in her lifetime. Women have 70% of all hip fractures. Hip fractures are one of the main contributors to ending up in a nursing home because you can no longer walk and take care of yourself. If you break your hip, 50% of the time, whether you're a man or a woman, you will not return to pre-fall function. You may not be able to live in your home. You may not be able to drive and be totally independent. And 30% of the time, people with a fracture will die, either from the complications of the fracture, from the bed rest, from the infections they get, the bladder infections, just the sequelae of being that sedentary. So my friends, those stats are not meant to scare people, but to inform you of how crucial bone health is. There are other reasons to care about the bones. Bones are in our body from the top of our head to our pinky toe, right? Bones are master communicators. The fact of the matter is, when we're talking about the musculoskeletal system, bone, tendon, ligament, muscle, fat, cartilage, muscle stem cells, they are all derived from the same stem cell, the mesenchymal stem cell. Within musculoskeletal tissue, muscle and bone are not separate. They are one ecosystem. When muscle releases a protein called irisin, it talks to the bone. When bone releases a protein called osteocalcin, it talks to the muscle. But in the case of bone, if we just stick with that protein, it talks to the whole body. When your osteoblasts, the bone-building cells in your bones, release osteocalcin, it goes to your brain and has a neuroprotective effect by decreasing inflammation. It goes to your brain and causes the synthesis of neurons in the hippocampus. It goes to the pancreas and helps with insulin sensitivity. It goes to the muscle and helps the muscles scoop up glucose out of the blood. If you're a man, osteocalcin can travel to the testes and that organ, the Leydig cells, under stimulation of osteocalcin, will produce testosterone. So it's like a miracle and a wonder that we just think of bones as the strong, silent type that hold up our muscles, because actually, bone and the proteins that it produces are master communicators. And it makes so much sense because we have bone everywhere in our bodies. How do bones release substances into the body? Another job of the bone is as your body's storehouse. Calcium is a critical mineral in our body. We need it for muscle contraction, for pushing molecules across cell membranes, but we've got to store it somewhere. So when we eat food, our intestines pull it out of the food we eat and store it in our bones. And so, our body is always sensing how much calcium, how much phosphorus we have, and what we need. When our body senses that we need more, it goes to the bone. It tickles the osteoclasts and says, "Osteoclasts, we need some more calcium." The osteoclasts break down some bone, release calcium, and it goes into the body for use. And then the body has enough to use. The body does not just keep piling it in because too much calcium, known as hypercalcemia, causes heart arrhythmia. The body is perfectly in homeostasis, in balance. So when the bone has released enough, it sits back and keeps storing it. The calcium your body doesn't need, if the bone is full, is excreted through the kidneys. The body is such a miracle like that. What's making your bones fragile? There are lots of things that go into bone fragility or osteopenia. One of them is not laying down enough bone in our youth. Estrogen plays a critical role in laying down bone in young women. So starving ourselves to look skinny may lead to inconsistent menstrual cycles and low estrogen. Studies show that gymnastics is a good sport for young women in bone building due to the pounding of bones, which makes them stronger. The second place in the lifespan that we may become low in bone density is during breastfeeding. A woman breastfeeding will lose 20% of her bone density in the first 6 months of breastfeeding. It is important to supplement with foods that are high in calcium like yogurt and dates. And then finally, there's this period around perimenopause, starting around 45, when estrogen levels become very chaotic and then ultimately zero. That can cause the rapid decline in bone density and bone weakness. And that's because estrogen is critical for controlling the absorption of bone. Without estrogen controlling the absorption, it just keeps breaking down bone faster than the osteoblasts can build it. Osteoblasts are the building cells of bone, so there's an imbalance, a dysregulation. Bone health across the lifespan is a vital aspect of overall well-being. From the time we are born until our later years, our bones undergo significant changes. In childhood and adolescence, our bones are in a rapid growth phase, and this is the best time to build bone density. Engaging in physical activities and ensuring adequate nutrition, particularly calcium and vitamin D, are crucial during these years. As we move into adulthood, maintaining bone density becomes the focus. Regular weight-bearing exercises, a balanced diet, and avoiding smoking and excessive alcohol consumption are key. Women, especially, need to be mindful of their bone health due to the natural decline in estrogen levels that occurs with menopause. In older adulthood, the emphasis shifts to preserving bone density and preventing fractures. This includes continuing weight-bearing and muscle-strengthening exercises, ensuring adequate intake of calcium and vitamin D, and possibly taking medications if prescribed by a healthcare provider. Regular bone density screenings can help monitor bone health and guide interventions to prevent osteoporosis and fractures. Throughout our lives, taking proactive steps to support our bone health can lead to stronger, healthier bones and a better quality of life. What is the bone-brain axis? As osteocalcin, proteins that bone makes, is released into the bloodstream, one of the places it goes is into the brain, and it can aid in neuroprotective effects. So what does that mean? Under normal metabolism, we develop free radicals due to normal metabolism. When we have oxidative stress, osteocalcin works to decrease that oxidative damage to repair cells in the brain. So that's number one. Number two, it stimulates the release of something called brain-derived neurotrophic protein, BDNF factor, which stimulates the growth of neurons in a part of the brain called the hippocampus, which is involved in memory. And here's the opposite side of it. We know in people that have low bone density, they also have higher brain cognitive dysfunction with age, and vice versa. There's an association in between osteoporosis and cognitive decline. What is osteoporosis? Osteoporosis is the word used to describe low bone density. It can be measured by using an X-ray called a DEA scan, a dual X-ray. It measures and compares your bone density to that of a 30-year-old healthy person and gives the result as something called a T-score. When you get a DEXA scan score and it's positive, fantastic, you have bones of a 30-year-old. If you get a T-score on a DEXA scan that's from 0 to -1, it's good. -1 is the definition of osteopenia, meaning watch out, your bones are getting weak. The definition of osteoporosis is a T-score of -2.5, which increases your risk of fracture by 40% or more. 2 million men have osteoporosis, and 1 in 2 women will have an osteoporotic fracture. so at least 50% of women. This is not inevitable, but it needs to be caught early. In the United States and in many other countries, you cannot get a DEXA scan paid for until you're 65. By 65, the damage is done. Early warning signs of osteoporosis. You can get clues from your family history. If you have parents that have shrank, that's a good indication that you have a family history where osteoporosis can exist, although it is normal to lose height in both men and women due to compression of spine vertebrae. Secondly, people who have had a family member with a hip fracture, that could be another indication. Finally, people who have been on high-dose steroids their whole life, due to asthma or an autoimmune condition, these can be very bad for bones. Smoking and vaping also affect bone health. So my friends, there you have it. Our bones are not just a structure holding up the body, they are very vital to our well-being. Remember, our mind and body are connected, a gem to nourish and nurture. If you enjoyed this video, please don't forget to like as a show of support. Comment below and subscribe to this channel so you will get notified when we upload another informative video.